the day of the picnic, just a normal, everyday kind of thing. Dan was helping flip burgers, and I'm sure he ate one or two while he was doing it. Partway through, we'd been there maybe an hour, not more than that. He came over to me and he said, we need to go home, I don't feel well. And my oldest son was there, and I heard him say to little Dan, son, I'm going to pass out now. You need to catch me and then call 911.
That heart attack actually damaged a third of my heart. That third will never again work.
That's a pretty large amount of tissue damage. We're not happy with the status quo because there's still more we can do. Cardiovascular diseases is still the #1 killer of people worldwide. About 50% of the patients who are diagnosed with heart failure die within 5 years. And now in heart failure, we're realizing that there's more we can do. Heart failure in general refers to a heart's inability to pump blood successfully or optimally through the rest of the body. So your lungs oxygenate your blood, your heart distributes it around to the rest of your organs. If that heart doesn't work very well, you can lead to other organ failures such as kidney failure, liver failure, and lungs becoming congested with fluid.
When I first heard that I had heart failure, it was a shocker because I had up until that time thought that if I do all these things and set all these goals that I was going to be okay. Once your heart starts to go bad, it stays going bad. And the best you can do is to manage it. I have tried not to let it affect my quality of life. You have to climb stairs, it takes a little longer, and get out of breath sooner, and you can't do as much work. When you used to work 8 hours in the yard, maybe you can only work 2 or 3 hours in the yard and still come in tired. So
the doctor said, I asked him, I said, now that we've gotten through this, is he going to be okay, or what do we have to look forward to? He said, the average for right now to keep people alive after a heart attack this serious is 18 years. And I thought, well, at least that, gets us into our 60s.
They gave me about, 12 to 14 years when I told my wife, and I beat them 31 years. So that's a bonus. She's the perfect lady. She's the perfect spouse. She's the perfect companion. She's perfect in every way. It's pretty wonderful.
I have to tell you the story about that dollhouse. When he had his heart attack in 1986, my oldest son bought him a dollhouse kit, and he said, I know you're going to be out of work for a while and you're going to be bored, so here's this dollhouse kit, and we thought you'd enjoy putting it together. And it sat. A couple of years before I retired, I was taking a bunch of time off. I was only working part-time then, and I said, you know what? I'm going into semi-retirement, and you know what I'm going to do? And he said, what? And I said, I'm going to put together that dollhouse. And he said, what a great idea, I'll help you. So I got that darn dollhouse out and I started working on it. And that summer, 2 of our grandkids came and helped us, and they painted and we cut, and it was just great.
What did I help with? Anything?
Oh, you were there cheering us on, and we did a few things here and there. And so we spent the summer doing that dollhouse, and it just turned out beautifully. So it finally got done after all of those years, and we got the dollhouse in 1986, and it was completed the summer of 2014.
Wow. I would not be alive had it not been for all of the medications and the help I've got through medical science.
We want to develop that next new medicine for them to, again, give them hope for the future, give their families hope for the future.
There'll either be a new pill, or there'll be a new gadget, or there'll be a new something, and he'll be the benefactor. We'll both be the benefactor.
You hear that, BMS?
That's right.